Hi, my name is Kayla McLean, and I'm an occupational therapy student at the University of St. Augustine. And today I'm going to talk about a recent study that I did a AOTA cap on. And the title of my study is the Transcutaneous Electrical Nerve Stimulation for the Control of Pain During Rehab Following Total Knee Arthroplasty, a randomized, blinded, placebo-controlled trial. And as you can see, this is a recent study conducted in 2014 in Iowa, here in the United States. The purpose of this study is to show the effectiveness of TENS in reducing pain and hyperalgesia while increasing function in subjects following a total knee arthroplasty, also known as TKA. The author's hypothesis included decreased pain during range of motion and fast walking, less hyperalgesia, and improved function at the knee. For the study design, this study had a sample size of 317 subjects. It was a long study starting in June 26, 2008 and ended December 20th, 2012. It is an experimental design, randomized controlled trial with level 1 evidence. All subjects were randomly assigned to 3 groups: the TENS group, the placebo TENS group, and the standard care group. The inclusion criteria for this study included patients had to be over 30 years of age and English speaking. They had to have knee osteoarthritis. They were scheduled for a primary unilateral TKA, and they had to be patients of the University of Iowa hospitals and clinics or Iowa City Veterans Affairs Medical Center. Exclusion criteria included a stroke or CNS disease of mental impairment that caused the patients not to understand the directions, chronic pain other than the knee, sensory impairment over 5 dermatomes in the surgical leg. They had to be wheelchair bound, pacemaker or allergic to nickel, and had used TENS in the last 5 years. As far as the intervention, for the TENS group, the patients used a TENS unit with a frequency of 15 pulse per second and a pulse duration of 150 microseconds. The subjects were asked to use the highest tolerable intensity. The TENS was used 20 minutes before exercise and then while the exercise continued throughout the session. And the exercises include flexibility, strength, and endurance. And the subjects were asked to use the TENS unit 1 to 2 times per day until their 6-week follow-up. So the patients were in the hospital, had the surgery, started rehab at the hospital, used the TENS unit that the physical therapist prescribed, and then they were allowed to take the TENS unit home and had to use it 1 to 2 times per day and had to come back at a 6-week follow-up. The placebo TENS group did the same exact thing with the same parameters. However, when they were asked to feel a sensation when the TENS unit was placed on the knee at the hospital, the physical therapist decreased the amplitude by 0.5, and then this setting was a setting that they used throughout the rest of the 6 weeks. And then the standard care group received no TENS unit. They were on medications before, during, and after their surgery for 6 weeks. Oxycodone and Celebrex was used before surgery 2 times a day while hospitalized. During surgery, they had general anesthesia, and it was followed by isoflurane or cefoflurane, oxycodone and morphine intravenously every 30 minutes following surgery for breakthrough pain. And then they also were prescribed Percocet as needed once they were discharged home. And then also the TENS group and the placebo TENS group as well also had these medications along with the TENS unit and the exercises. So the standard care group only received these medications. Significance of study outcomes. Statistically significant, the TENS group only had results for pain during active knee extension, had a p-value of 0.019, which showed improvements with the decreased pain. And then they had less pain during fast walking with a p-value of 0.006. And both of these were during the post-operative period, which was right in the hospital during rehab. There was no statistically significant results at the 6-week follow-up. Clinically significant, even though this study showed effectiveness for only post-operative period, TENS is still an effective treatment with addition to medications for reducing pain. As far as strengths and limitations, the strengths, this study did include 3 groups for comparison. It was experimental design, randomized control trial. It had a large sample size of 317 subjects. They had blinded randomization, and it had a long duration of 4 years. For limitations, the authors thought they lacked ethnic diversity in their sample, and then they also had lack of blinding within the groups. And what that meant is, even though it was a blinded randomization, the authors felt that the subjects in the placebo group knew that they were receiving active treatment, so they felt like that hindered their results just a little bit. So implications for practice. TKA is a common surgery performed to reduce pain and improve overall function for clients with osteoarthritis. So rehab following surgery is painful that the patients have to go through after this surgery, and TENS proves to be an effective modality to use to reduce pain during this time frame. So again, even though these results are not effective at the 6-week follow-up, TENS is effective to reduce pain at the hospital during rehab. So as far as applications for OT, again, just like I had mentioned, even though TENS is not effective at 6 weeks, it is extremely effective during the rehab stage at the hospital. And so for OTs, what that means is, as a future occupational therapist, I can use TENS to help reduce pain after these surgeries while I'm seeing patients in an inpatient acute rehab setting. So it's more encouraging and motivating for the clients to get up and perform basic ADLs such as grooming and dressing and toileting, knowing that their pain is going to be decreased, which again is motivation for them to get up and to participate in therapy with the TENS unit, since it is reducing pain. And that is a summary of the TENS unit on patients who have gone TKA surgery on the knee. Thank you.